to start piling in, but knock out a little bit of housekeeping and reminders here today for all of us. As a reminder, this is the CMS 2027 Final Rule webinar.
Yeah.
It feels good getting this done before May, getting it out there.
Absolutely.
Although May's tomorrow, I say that like we're weeks away, but it'll be here in just one sleep. But we've had a lot of really exciting industry news coming out in the last couple of weeks, and feels good to have a nice runway to prep for everything.
Absolutely. I love it. I'm here for it.
Good deal. As a reminder, today is going to be recorded. We will be monitoring the questions throughout the event, but do most of the Q&A at the end, give you guys lots of time to think about what we want to ask and how we want to talk about it. But Chalen, anything else?
Nope. I think keep those questions coming. Don't hesitate to toss it in the questions box. Even if we don't address it till the end, I don't want you to forget about it and not get a question answered just because you held off on it. But yeah, I mean, it really kind of crazy to say it'll be quick, but the rule was not as crazy as it has been the past few years, and a lot of good news for a change. So I'm pretty excited about it.
No, I would tend to agree. I think a lot of really exciting news. You know, we only have a handful of slides today. So if you have some intricacies that you want to ask questions about that maybe we didn't put in the slides, please fire that in there. But to Chalen's point, I think a really agent and consumer friendly rule that if I was you guys as brokers here, I'd be pretty excited about the way it shook out.
Yeah, I think a lot of flexibilities, a lot of additional opportunities for agents to work more effectively and efficiently with their clients. Don't get me wrong, there's definitely still a lot of plan level pressure in this rule, and we're going to continue to see that as a challenge through AEP 2027, but it's going to give you more flexibility to help manage that process and better manage that client workload.
Yep, absolutely. Well, with that, Chalen, you want to click us through on the slide?
Right. Get on through.
So we're starting off with, I think, two of some have been the most popular ones to see all across social media. I think they were the first to hit the airwaves, and I don't think for a bad or an incorrect reason.
No, I think losing the 48-hour rule again. It's definitely been good news for a lot of agents. So that's been a major pain for the past few years, after going away initially in 2018 and then coming back in 22 and now going away again. Man, record keeping is fun stuff, let me tell you.
No kidding. Although I do want to set the stage and remind this is not until plan year 2027 appointments and benefits. So please, for the next 6 months, and as long as it's a 2026 plan year enrollment, please abide by the 48-hour scope rule. I do not want any of you guys getting in trouble. I don't want to have to get that phone call.
Agreed. And you know, it's really interesting because there's a lot of flexibility allowed by this rule, not just with removing that 48-hour waiting period, but some changes and flexibilities around how scopes are collected. CMS no longer mandating a specific format as long as certain criteria are met. You'll see more from us from Integrity later this year as we get some clarity from CMS, some sub-regulatory guidance, because we still had a few questions. There were some things that didn't quite add up, don't quite make sense about, you know, some of the things about scope appointment and when they need to be collected and in what format were a little incongruent, you know, didn't match up. So we're still waiting on some sub-regulatory guidance, but by and large, the overwhelming view is when in doubt, get a scope. You don't have to have the waiting period anymore. So you can always just get another scope and you'll be fine, but definitely need to take a look at what your processes look like. Those scopes will be good for 12 months. Those scopes can be collected at educational events now, which bleeds into this next point of getting rid of that cooling off period between sales and educational events. So no more prohibition where we can't have an educational event and a sales event in the same day within 12 hours. You know,
pretty tight squeeze.
If you're doing, I mean, if you're doing, you know, the early bird breakfast meeting and then
you could squeeze in
and then the cocktail hour, you know, you could make that work, but by and large, it made it very difficult to run multiple meetings in one day. You've got a lot more flexibility now, as long as you have that clear delineation of when education ends and sales begins.
Yep. So, two things that I'll kind of add on here. With the scope of employment portion of this, what I would tell you is continue to utilize Integrity Connect for this. If you want to make sure that at the end of the day, no matter what, I'm going to be good to go, the scope is going to be valid, CMS would accept it. Heaven forbid I have to send something to them for a compliance question. Continue to use Integrity Connect for that. It'll make sure that you are always abiding by your compliance guidelines. You don't have to worry of, is this scope valid? Did something get changed? And I'm sure a word Chalen has said 5,000 times in sub-regulatory guidance on that, and we'll continue to probably say that word a bunch over the next few weeks.
That's the world I live in until October.
Chalen, you mentioned that they have to have a clear line that we're transitioning from education to sales. What does that look like for a broker?
Yeah, so let's use a little common sense. I mean, you need some kind of clear announcement and an actual opportunity for someone to get up and leave the room if they don't want to be there for the sales presentation. So it cannot be as simple as just saying, hey, this is the end of the education portion. We're going to move on to sales now, and then rolling right into your next slide. Let's give folks a shot to actually take that break. Common tactics that we used back in the day when we could do this originally. Let's take a bathroom break. Give folks a chance to stretch their legs a little bit. 10, 15 minutes, whatever makes sense for you. Chance for folks who want to leave to get out of there. The other thing is there may be folks that just can't commit a couple of hours to you and just need to leave, and you want that break so they have enough time to come up and talk to you afterwards. If there's, if you've got 25 people in a room for an educational event, 5 of them decide they either don't have time or don't want to deal with a sales presentation right now, you don't want to roll right into that sales presentation with the other 20 and let those folks walk out the door without the opportunity for a conversation. So be thinking about that as you look at your processes and you're booking things out for this fall or even next year. Make sure that you're thinking about the logistics of what can I do to still value capture from those folks that do want to walk away from the event, and make sure that I'm still giving them an opportunity to reach out to me in the future by collecting that scope, that permission to contact, getting an appointment booked with them if maybe they're just not comfortable having that sales conversation in that public setting. We don't want to lose any of those folks because of our process.
Absolutely. I think if I'm trying to lay out my groundwork for the rest of this year and honestly into 2027, look, we've been talking about events for a long time as a huge opportunity to boost your book of business and boost your retention with your existing membership as well. And I think this portion in the final rule is just leaning even more heavily into that. I think our consumers are hungry for that in-person interaction. I know it sounds funny to say 6 years later, post-COVID, but that really has been a big shift that we've seen in the last couple of years, of people, kind of dying to have that community center of influence with who they're working with on things as well. So if you're not already actively doing seminars, maybe you've been hesitant about them for compliance regulations, maybe you just don't like public speaking, whatever the situation is, I would really consider now to be a great time to make a big push for them.
Absolutely. And don't hesitate to start small. It doesn't always have to be a big marketing push in a room of 50 people. If you've got, 10 folks that have a knitting club at the local library is a fantastic place to start, or that coffee shop down in the corner where all the old farmers have coffee in the morning.
Absolutely.
I mean, there's no wrong way to start this process. Just get in front of people, get comfortable with your slide deck, get comfortable with your presentation, so it starts to roll off the tongue a little more quickly, a little more easily, so you can really know how to hit the high points, which parts to emphasize over time. If as you present this more and more, you'll find ways to improve because you'll notice places where people get stuck or that you keep getting asked the same question over and over, and you'll find ways to improve that presentation over time. There's no wrong way to get started.
No wrong way to get started. And I would really encourage you, if you're looking at doing this and looking at getting started, build the presentation to match your voice and your style. And what I mean by that is, there's a lot of great prepackaged seminars out there. I think we have some phenomenal ones, but put your own spin on some of it, whether it's making sure it kind of matches your overall vibe. We've got some agents that create a theme to theirs, whether it's the road to 65 and it's, highway signs and car references and what have you, but make it feel like it's you and it's authentic.
Yeah, something authentic, something that doesn't feel, I hate to use the word sterile, but like, they can feel very classroomy, very
Yep.
non-personable. That's not what you want. You don't want it to remind people of the doctor's office.
You don't love going to the doctor's office?
It's fine. It's not my favorite place to be. I'm overdue for a trip to the DMV. I've got to get new tags on the truck, so I'm dreading that already. But it should not feel like the DMV. So yeah, give it a little soul.
Yeah.
Give it a little pizzazz.
Absolutely. Chalen, anything else on these topics?
No, I think we're pretty set here. It's good news all around. Definitely things that agents and brokers should be excited about in terms of those big parts of the process. And the good news keeps on rolling.
It really does. This first one is something I think a lot of agents are going to be really excited about. I cannot tell you how many times when the prior final rule came out, people were like, you mean I have to read this entire sentence in the first 60 seconds when someone barely knows me? That just feels cumbersome. I got to tell them I only represent 5 of the 7 carriers and 62 products. And I got to tell them to call Medicare and to call SHIP.
Absolutely. No more. That's one of the biggest things that got carved out. And some really good news. I mean, that timing of the TPMO disclaimer is a huge win for agents and brokers. We don't have to give that TPMO disclaimer until we start discussing specific plans, specific benefits. You can have your warm up, you can have your hellos, you can talk about the grandkids or the cats or the dogs, whatever you need to do. But then when you do turn that discussion towards actual plan discussion, talking about benefits, doctors, drugs, that's when we can go ahead and give that disclaimer. Make sure we're, again, recording those enrollment calls.
Please.
But that is change. The script is changing a little bit. We're going to carve out SHIP from the TPMO disclaimer. You'll still have to be directing folks to Medicare.gov to get more information on all of their options. But some of that's a little unavoidable at this point. So we'll get full wording on the new disclaimer out again later this summer before this change takes place. And we'll already mention it once, but functionally all these changes take place 10/1. When we start marketing 2027 plan year products, that's when all of this really starts to apply. And in call recording, again, if you're already using Integrity Connect, keep using that. It's going to keep you safe and secure. If you're not already using Integrity Connect, consider hopping on there. It's a great system for recording those sales and enrollment calls. But we've got a little bit of relief there as well. A couple clarifying points. We do still have to keep those recordings. Anything sales and enrollment related needs to be recorded. And enrollment calls, that actual process of taking the app, does still have to be retained for 10 years. But sales calls where you're maybe just talking products, not actually conducting the enrollment process, those sales and marketing calls only need to be retained for 6 years. And you only have to have that full audio for the first 3. After that, it can just be a transcript. So again, if you're not already using Integrity Connect, take a look at it. We've got some great folks that can show you how it works. Some great trainings available on Integrity Connect. It is going to be the go-to solution for you.
Absolutely.
Through the rest of this year, through next year, and into the future, to just make this easy. It's going to solve those scope problems, it's going to solve those recording problems, and make it easy to be in compliance and easy to answer for any future investigations or concerns.
I think you hit a great point there. And something that I was talking about on another webinar that I was doing is, look, as a business owner and as an independent operator, you guys have hundreds of random line item expenses every month. If Integrity Connect can take care of your call recording expense and your call storage expense for all of that data aspect, look, I know cloud storage is on the cheaper end of things for right now, for the time being. But if you can cut that line item out and kind of give yourself a little bit of a revenue boost here, every little bit adds up. And so great point to continue utilizing Integrity Connect. If you're not already utilizing it, let's get that evaluated. I've had a lot of agents ask me, can I just keep the whole dang thing for 6 years? It feels like a lot of work to carve out a full audio and then just store a transcript. And I would say absolutely, you can just keep the full recording for 6 years. If that feels cumbersome to you to kind of carve them out and pull one out of the other, keep the entire call recording for 6 years. Absolutely no problem there.
And if you're using Integrity Connect, you just don't have to worry about it.
You don't. It does it for you.
Done for you.
Yeah. Yeah, I definitely am pretty excited about the TP mode disclaimer once we roll into October there. That's going to feel a
Yep.
lot more natural
It really
in
will.
conversations.
Yeah, I think so many people are very used to that process already. You know, it's so awkward to answer the phone and have someone shout a disclaimer at you before you know who's calling. And that's where a lot of agents found themselves.
Yep.
They felt forced into that process, but being able to have a real genuine human conversation, and man, it feels weird to say human, but I think that's increasingly valuable
Oh my
in a lot of
goodness.
ways.
I know
So
it.
I think that's going to be a big winner this year. You know, as we go into another hectic AEP,
Yep.
that human touch is going to matter more than ever.
Yeah, you talk about AI and human touch on phone calls feeling more and more rare. I called to get some maintenance schedule done on one of our vehicles, and it was an AI scheduler.
Yep.
And it pretended to be a human, but you could just tell that something was not quite right. And I didn't end up scheduling, needless to say. But that's for a separate conversation. But I think that human element is huge, and getting to kind of have a true warm up with the consumer, especially for those of you that work in multiple states.
Absolutely.
It's going to make that a world of difference for you.
We can talk about good and bad uses of AI in a different webinar,
Yeah.
but we digress.
Yes, absolutely. Anything else on this point, Chalen?
Nothing I've got. I think
All right.
I think we hit it pretty good.
This is one you talked about, some kind of downstream plan pressure that we're going to continue to feel. I know we're not talking about it today, but if you haven't seen the funding update that come out, I think that came out, that in combination with what's changing on star ratings is going to definitely have a downstream impact to plans, the way consumers interact with them, and the way you as brokers need to be evaluating it.
Absolutely. And I think, looking at, I think it's okay to talk about the rate notice because it really does tie into a lot of what we're talking about here. So every year when CMS puts out that rate notice, I think a lot of folks have the misconception that that's kind of like, when you get your annual performance, you can get a raise or don't get a raise.
Yep.
It's not really how it works. CMS takes all factors into consideration. And really all they're saying is based on the policy changes that CMS is making, based on the underlying growth rate in fee-for-service Medicare, based on things like changes to star ratings, changes to how coding is done, all these other factors, the average plan can expect to see this change in revenue. And of course, initial projections were 0.09%.
Oh, that would have been bad.
It would have been real bad. It came in as a final at 2.48%.
Yep.
But again, remember, that is not just across the board 2.48% pay bump for plans. That's based on the average plan's experience, and a large part of that factor is star ratings. And in this case, a lot of things being pulled out of star ratings. So in some ways, you can look at it this way. CMS is making it a little easier for future plan years for plans to focus on a smaller number of measurement metrics. They can focus in on those. They can drive towards better performance in those metrics without some of, CMS really described them as kind of like checkbox metrics, administrative things. Teaching to a test is a term they used in the rule. So a lot of really admin-based metrics, whereas now it's a little more focused on clinical outcomes, a little more focused on how plans actually perform in taking care of patients. Now, the good news is, I think that's a great direction for CMS to go. I think it's a great way for them to look at how plans perform and focusing on what matters to consumers. It doesn't mean that plans are going to catch up tomorrow. It doesn't mean that they're going to catch up in the next year.
No, these things have, correct me if I'm wrong, but I would say probably it's more of a 2 to 3 year runway for a true catch up and adjustment to
it really is, because when you look at a plan, there's so many factors playing into it. Right now in May, they'll start doing some of the member performance surveys for this year's star ratings, which will come out in October, which will be the star rating that a plan has for 2027 and will affect their payment rate in 2028. And so it's this big ongoing cycle. So as we go into measurement year 2027, which will affect 2028 star ratings and then beyond, that's when these new changes are taking effect. So none of these changes are really affecting star ratings that are being assessed right now, but it really affects how plans are bidding, because they're looking 2, 3, 4 years down the road. If we're locked into this payment structure where we can only change so many things year over year,
Mhm.
hitting that total beneficiary cost threshold,
Yep.
some of the other metrics they have to hit every year. We may have a 2, 3, 4 year cycle before we
Mhm.
can make enough changes in the right spots to
Absolutely.
remain profitable, remain a successful plan
Yep.
that is worth someone being enrolled in, and start adjusting for these new clinical outcome measures.
Mhm.
It's going to be a process. You can see the chart in the final rule if you read it. They do some anticipatory math of what
Yeah.
the overall payment rate changes would be. And frankly, right now it shows, hey, we really do expect star ratings on average to fall
Yeah.
quite a bit in this first couple years of these new
Which has a
measurements.
huge impact to plan funding.
It really does.
I think we've been speculating for a couple of years, and I'll be curious, Chalen, your thoughts on if the star rating adjustment is going to feed that or kind of put the fire out, so to say, that HMOs are going to continue to be a big push by the carriers, where we look at clinical outcomes, a little bit tighter of networks, more continuity and community care there, and value-based care, and then continued drive towards SNP plans, D-SNP and C-SNP. Would that be still fair to say with the new star rating system?
Yeah, I think that's not driven just by star
Sure.
ratings, but I think that's definitely a factor driving some of those changes you just mentioned. And I think that's definitely a likely direction for the market to continue to move. Anywhere where a carrier can better control that continuum
Mhm.
of care
Yep.
and have more eyes on it, more hands on it, that's going to continue to be a priority, especially as they're up against competing objectives or
Yeah.
directives, such as reducing the amount of prior authorizations,
Yep.
things like that. The only way you can really effectively reduce prior authorization and manage cost is with some of those tighter networks, better provider relationships, more
Referrals.
value-based care arrangements, referrals. So, you've really got to look at, if we want to get rid of or substantially reduce prior auth,
Mhm.
what kind of provider relationships do we need to be
Yeah.
developing to make that a realistic possibility? And I think one of this last bullet point on that slide about the new depression screening and follow-up measure, that's a big step in the right direction for mental health parity
Mhm.
in Medicare, which has been a little behind even the group and individual markets. But it's going to require folks that have a positive depression screening in a primary care setting or an emergency
Yep.
setting it's going to measure what percentage of the folks on those plans have a follow-up with a mental health professional within 30 days. So you'll probably see a lot more changes in that mental health benefit space over the next couple years as carriers try to adapt to that new star ratings measure and make sure that they're really hitting what's going to be a pretty well-weighted measure in the star rating. Because again, now that we're shrinking it, to give you guys an idea of the numbers, we're going from 42 total star ratings measures in Part C and D to we got rid of 11, I think. So we're going down
31.
to 31.
Yep.
So when you talk about focus, that's true. Carriers can focus a little more.
Yeah.
But the spread of how much each measure impacts that star rating overall is being amplified.
Absolutely.
So they've got less margin for error on each individual measure.
Chalen, do you think that last aspect here, where we talk about having that follow-up with someone in the mental health field, is it going to continue to drive seeing more adaptation from people in that field taking Medicare assignment? Because I know for a long time that was a discussion of, if you look at the statistics of who did not take assignment, that was a large majority, or almost a majority of it at one point.
Yeah. At one point, about 42% of non-pediatric physicians that did not accept Medicare assignment were psychiatrists. Now, when we're talking about mental health, it's not always a psychiatrist.
Right.
There's a lot of folks outside of actual psychiatry that are still in that behavioral health sphere that might help meet this measure. But it is definitely a challenge. It's an underserved market already, where it's really difficult to find providers that are not just in network but have availability.
Yes.
That's always the big thing. It's even if you were to call up and say I'm paying cash,
they still just don't have openings, or it's a month or two.
Providers just do not have openings. So carriers are going to be looking for unique ways to help administrate this type of benefits. I would say probably it is very likely that we may see some new and innovative telemedicine benefits specifically geared towards mental health. that's going to be one way to look at it, especially in a lot of rural markets or markets where with low provider densities in the behavioral health space. So it's definitely going to be a challenge for carriers to figure out, but I think they've got a lot of opportunity to provide these innovative solutions that CMS is really looking for and prove a new model of care to allow expansion of even more behavioral health benefits.
Anything else you want to add on the star ratings? I think we're covered that one pretty well.
We're moving in a group and pop those questions in the chat.
I know. I can't wait to see the question box when we get to the end. Look, there's a lot.
Will's the worst because he won't let me open the question box until the end.
I never said you couldn't do it.
Oh, okay.
You can pop her open. I just usually answer them all at the end when I do webinar. So we can pop open that question box, Chalen. Say expand it out so we can see.
There we
go. There's a lot on this slide, and
absolutely.
I think all still driving in the right direction for this. I think there's a couple aspects of this that may cause some people to pause and say, what does that mean? And I think the first one is probably the biggest, confusion point of what even are passive D-SNP enrollees?
Yeah, absolutely. So this is something we've seen for a few years now, but increasingly with the jump to more integrated D-SNP plans, these HIDE and FIDE D-SNPs, specifically the FIDEs, as states work to better integrate their Medicaid, Medicare populations to reduce costs, we're seeing more and more of these passive enrollments, where if you have those aligned beneficiaries where they're enrolled in a managed care organization through their state Medicaid benefits, and that MCO parent company also offers that aligned D-SNP plan. In many cases, CMS will passively enroll them into that D-SNP plan. So that's great for a lot of folks. It gets them into that coordinated care quickly. It doesn't rely on them needing to reach out and ask for that benefit. It just gets them plugged into coordinated care. But this also recognizes the reality that these are folks that often have complex polychronic medical needs that may already have established care with established local providers, and providing this continuity of care is going to make sure that they aren't stripped away from providers they're comfortable with, aren't being thrown into a totally new system with doctors that don't know their situation or their experience. It's going to give them a transitional period that helps both sides. It helps the patient remain with providers they're comfortable for, either through the transition to a new doctor, or it gives plans the opportunity and this timeline where they can start negotiating with providers that they maybe hadn't considered as network partners before. So it is going to give some flexibility on both sides of the aisle for that, but it's all about maintaining that standard of care for those at-risk enrollees.
Yeah. On the flip side, for a broker, what does it look like if a consumer comes to you and they've been in this passive enrollment situation? What are your SEP options if maybe that is not a good fit and their core provider's not in network? What does that look like as an agent to handle that situation?
Yeah, it's going to vary a lot by the state, because as we know, there's been a lot of changes with D-SNP enrollment periods. At this point, if it's mid-year, the only way that they're going to change to another plan, even in the D-SNP space, is if they change to a different managed care organization.
And that is way varied by state on when, how, if you can.
Exactly, yeah. So it may not be as much of a year-round enrollment opportunity as we've seen in the past, but again, that's going to vary widely by state and how they're structured and what plans are available in those markets. But again, this core principle of aligned care is not going anywhere. It's going to continue to expand.
I think they're going to amplify it if anything going forward.
Absolutely. I mean, the pretty clearly stated goal of CMS remains to have nearly 100% of beneficiaries enrolled in some kind of value-based care arrangement within the next 10 years. And these aligned Medicaid, Medicare plans are definitely a big part of that strategy.
Yeah, and I think we'd be remiss not to talk about, we obviously last year we made the transition from VBID over to SSBCI. And look, I think no way around it. If you're an agent and you sold SNP plans last year, you dealt with a lot of questions, uncertainty, and possibly even confusion around the heck is SSBCI? How does this work? How do I even go about making sure before I enroll someone that they're going to be eligible for these benefits that I'm talking to them about? Not only that, are they going to get, 30 a month where it says 120? How do I actually go about all this? I think there's a lot of constraints is maybe too strong of a word coming to the SSBCI, but I think it's good stuff. So not only some of the changes around, verification of the purchases, no rollover of the benefits, documentation expectations, but I think the last one is a big one that should give anyone working in the special needs plans market a big sigh of relief.
Yeah, absolutely. Just this transparency around the process is really the core of what CMS is getting at. They want to incentivize carriers to offer these SSBCI benefits to see, how they can improve health outcomes for even these non-health benefits.
You mentioned it again. How we can deliver on health outcomes is a big focal point. I think that,
the banner words for CMS,
absolutely. And so for the brokers on the receiving end of this, that means we need to go back to doing a full needs analysis for that consumer and really diving deep with their needs to make sure that we can play our part to hopefully, as much as possible, steer the ship in the right direction to try to help smooth out these waters.
Yeah, and I think as we look at agents, more and more as people to help in that care coordination process, there's been a lot of discussion in the market around the role of agents and brokers and how that may be expanded in the future and what we can do to better serve clients. I think that's, we've done a really good job over the past, decade of getting really used to talking about who are the doctors you're seeing, what are the drugs you're taking, what's your pharmacy, some of those basic, it's almost a demographic question, it's at this point. But I think there's also that opportunity to talk a little more deeply about those actual health conditions. What are the challenges you're facing? Because there may be a specialist you should be seeing that you aren't. There may be a type of service or provider that you may need access to that you just haven't had access to in the past or didn't know you had access to. So I think it needs to be a little more about, what are the things that you need, not just what are the things you're already using. Because we're solving for two different problems there. One is solving for, are we going to put you in at least as good a spot as you are right now? The second path is really, how can I put you in the best possible position as a consumer of healthcare to get those outcomes that you want and make sure that you have benefits that are usable to you at the time that you need them in a way that's accessible.
You mentioned, and I promise guys, we'll segue back to what we were actually talking about with the clarity around SSBCI, but you mentioned, seeing a provider or a specialist that you're not, that maybe that you need to. Another plug for Integrity Connect on that. If you put in a medication that is tied to a specific chronic or tied to chronic conditions, as the agent, you'll see a pop-up that says, hey, they're taking this medication for insert, chronic condition here. You don't have a specialist listed. You might want to ask them if there is anyone they see to kind of continue to Chalen's point, make sure we're getting stronger outcomes at the end of the day for our consumers. But anyways, that segue and that sidebar conversation aside, what are we looking at on more clarity to the SSBCI qualifications?
It's CMS is trying to make it super simple. If you're going to offer these benefits as a carrier, documented, verifiable, objective processes for determining eligibility. It can't be subjective. It can't be fuzzy. It can't be hidden. People need to know upfront, here are the benefits. These are benefits you have to qualify for. Here are the conditions, the CPT codes, whatever it is. Here's how we are qualifying.
And that has to be
those
publicly available and published,
it has to be published on plan websites. So this fall, going into plan year 2027, we should have a lot more accessibility to information around how those benefits can be had by our clients. Less confusion, lower rapid disenrollments, better plan performance, better satisfaction. All of those things that are important, not just us as agents and brokers, but also to our carrier partners that are looking for that stickier business and satisfied clients.
At the end of the day, that's what it's all about. If I were to sum up this slide as a great takeaway for agents, it's now's not the time to be backing out of the special needs market. I think if anything, this is a great time to push deeper into it. If you've stayed out for whatever reason over the years, when we look at the integrated opportunities, more plans go into that MCO and that HIDE and that FIDE system. We've got prior videos about that if you haven't had a chance to watch them, but there's going to be a big push by CMS. And if you want to talk about positioning yourself as an agent to succeed, you need to be kind of following where the trends are going and not backing out of where the waves are at.
Absolutely. Yeah, I think there's just nothing but opportunity in both the dual market and the chronic special needs market. You know, we saw the chronic market absolutely explode this past year with opportunities. The fastest growing segment in MA was chronic special needs plans. And, you know, it just points to, again, carriers really looking at how to deliver that better coordinated care by identifying populations that can be plugged into specific benefit designs that better meet the needs of that specific health profile. And that's going to continue to be a trend over the next couple of years as carriers are facing some of that cost pressure and those spending pressure. Being able to better segment their markets is going to help them bucket people into more specific plan designs that make it easier for them to deliver that quality care.
Absolutely. Well, I think I'll go ahead and dive us into questions. Please pop your questions in the chat. We only have one so far, which Chalen either means we did a really good job or we just have people that too, or we just have people also all sorts of lost and confused on what in the heck are we talking about. So first question in the chat is the SOA also, once used, you have to get a new one and only for that specific plan year? Has that changed at all?
Yeah, so Michelle, that's a great question. These are some of the things that we're getting a little bit of clarity on. There is some language in there in the rule that these would be good for a full 12 months, regardless of whether you use it or not. But there's also some concerning language about, you know, needing the SOA in a certain format, depending on how you're meeting with the client, or needing it, you know, considering, you know, you have to get a new scope anytime you're going to talk about a new product type, and considering new plan year, same actual product to be a new product. For example, if I, you know, anyway, point being, there's still some unanswered questions there. As soon as I hear back from my guy at CMS, I will let you know.
Are we waiting for more sub-regulatory guidance on that one?
Yes, that's exactly what we're waiting on. That's exactly what we're waiting on. And frankly, I think CMS is probably still figuring out a little bit of it too. They're looking at, you know, I sent them a laundry list of questions based on feedback from some colleagues that I highly respect in the industry. And there's still some unanswered questions around that SOA process. But again, you know, Integrity Connect is going to keep you safe and sound. It's going to make sure that whatever those requirements end up being, we're meeting or exceeding those standards. But as we get more clarity, we'll definitely continue to push out updates.
Awesome. Well, we got another one come in. Any move on CMS having the carriers whittle down plans offered in an area? Any chance they weigh in on plans going non-commissionable mid AEP or OEP?
Yeah, so I haven't heard a ton about whittling down the number of plans offered in a market, you know, especially now granted, don't get me wrong, we still have a lot of counties that have 30 or 40 plan options. But in a year where we saw over 3 million people affected by service area
we had MA deserts last year.
We did have
nowhere had an MA plan option.
So I don't know that reduction in the number of plans in a market is really on anyone's radar right now. Now, obviously, what we do see is CMS doesn't want carriers putting out lookalike plans where they've got two different PBPs.
That sounds vaguely familiar to something that happened last year.
Yeah, so I mean, that's definitely still a concern is lookalikes, whether it's DSNP lookalike plans or whether it's just plans with exceedingly similar benefit structures. There needs to be that actuarial difference between them. As far as non-commissionable plans, CMS is pretty limited in their actual statutory authority of what they may be able to do regarding commissionable status of a plan. They obviously have their process for carriers to file during bids, whether or not they will pay compensation. Carriers are allowed to file a range, but you know, a lot of that responsibility would lie with Congress rather than CMS. They're bound by a pretty strict statute.
Yeah, and we talked a little bit. If you didn't catch the Senior Market Signal webinar a couple of days ago, we can get a recording out and there'll be another one next month as well. But we talked a lot about what to expect with commission adjustments going forward. the short answer is, guys, we're not out of the water yet on it. But I think the important reminder within all that is that really is the last ditch effort that a carrier has to slow down enrollment in a non-profitable plan for them. That is the last lever outside of exiting the plan entirely, but that doesn't help with existing MLR in that plan. And so that really is the last ditch effort, because they're limited by CMS on how much they can degrade benefits year over year. And I think that's an important reminder.
That's an increasing talking point. I mean, total beneficiary cost is a pretty hard wall to run up against in years with a lot of cost pressure like we've seen.
Yeah.
But right now, no major action. Of course, it's kind of off cycle for CMS rulemaking. Don't get me wrong, they are absolutely already talking about the 2028 rule.
Not ready to think about that yet.
But yeah, I wasn't either, but here I am.
Yep.
So that's definitely already a discussion that's being had at CMS, but we are a little bit off cycle for that rulemaking process right now.
Yeah. Well, guys, great webinar as always. I love doing this topic. Chalen, it was great to be in studio with you for this as well. If you guys have any follow-up questions after you've had some time to stew on it, maybe sleep on it for a night, you know where to find us, 800-689-2800. You can reach out to us on smsteam.net via our live chat. However you need to get a hold of us, carrier pigeons, smoke signals, whatever you guys may need. It was always a pleasure being here with you today, and we'll catch all you guys in the next one.
Yeah, thanks for having me, Will.